The pandemic has been a long and difficult road, and this fourth wave has been especially demanding and has taken a toll on all our staff. Not only in terms of the immense pressures that our staff face every day in the work that they do, but also the fact that our staff can become cases as well. Since the start of the fourth wave at the beginning of August, more than 2,500 AHS employees and physicians have become COVID-19 cases themselves. It's important to ensure the safety and well-being of our staff in the workplace. And so I want to emphasize some key points regarding personal protective equipment, or PPE, and other preventive measures. With respect to PPE, all staff caring for a patient with COVID-19, suspected COVID-19, influenza-like illness, or with new or changing respiratory symptoms must wear a procedure mask, eye protection, gown, and gloves, and carefully follow all appropriate steps when donning and doffing PPE. In those instances where an aerosol generating medical procedure, or AGMP, is performed on such a patient with COVID-19, suspected COVID-19, influenza-like illness, or with new or changing respiratory symptoms, the required PPE for individuals in the room include a fit-tested and seal-checked N95 respirator, eye protection, gown, and gloves. This is the standard guidance regarding PPE for COVID-19. I also want to highlight the joint statement with our unions regarding COVID-19 and PPE, which was issued in February of 2021. This joint statement gives all frontline professionals the authority to make decisions regarding the choice of PPE they feel is necessary for their protection based on their own point of care risk assessment or hazard assessment and their professional judgment. The joint statement emphasizes that our staff are free to choose the PPE they feel is most appropriate for them based on each patient interaction, and the PPE chosen can include the use of N95 respirators, which are readily available to all staff. Outside of an AGMP scenario, there may be other potentially higher risk situations where a healthcare worker may choose to don N95 as an alternate form of respiratory protection when caring for a known or suspected case of COVID-19. Some factors to consider in making this decision include the distance to the patient. So for example, being cheek to cheek with the patient would be higher risk than being 2 meters away. Another factor is the duration of exposure. For example, a 30-minute exposure would be higher risk than a 30-second exposure. A third factor is the surrounding environment where care is taking place. For example, are you caring for a patient in a bathroom or other sort of small enclosed space, or in a well-ventilated and larger patient room? A fourth factor is the patient's symptoms. For example, an actively coughing patient would be higher risk than a patient who didn't have respiratory symptoms. And the last factor to consider is the timing of your interaction with the patient in relation to that patient's course of illness. Patients are most infectious in the first few days of their illness. And so caring for a patient on the first couple of days of their illness would be higher risk than caring for patients, say, on day 8 or day 10 of their illness. So when you consider all those factors together, a higher risk scenario where a healthcare worker would likely want to choose to wear an N95 respirator might be a situation where a patient is actively coughing. The healthcare worker is providing very close sort of cheek-to-cheek care. Perhaps they're helping the patient with toileting in a small bathroom and for perhaps 20 or 30 minutes or so, and the patient might be very early on in the course of their illness. All these factors would lean towards sort of a higher risk situation where a healthcare worker would likely want to choose for an N95 respirator for their own protection. Since the start of the pandemic, our WHS teams have been reviewing COVID-19 healthcare worker infections very carefully. Based on these ongoing reviews, we are confident that, with very rare exception, the PPE guidance that AHS has provided is effective at protecting our staff and preventing transmission of SARS-CoV-2 in the workplace. But there are 3 key points that should be stressed. 1, PPE only works when it is worn properly and worn when it is needed. Point of care risk assessments cannot be overlooked, and precision of execution with donning and doffing is critical to ensuring that PPE will work effectively. 2, protection from COVID-19 requires layers of preventive measures, and PPE is only one of those layers. Other layers of preventive measures include fit for work screening and not coming to work when you're ill, even if the symptoms are minor, diligent hand hygiene, and physical distancing. And of course, COVID-19 immunization is an effective and important preventive measure. But just because you've been immunized does not mean that you can ignore other preventive measures. Currently in Alberta, roughly 1/3 of new COVID-19 cases are occurring in fully immunized individuals. This is why, even if you are fully immunized, you still need to follow all preventive measures. And 3, COVID-19 risk does not just come from patients. Staff who come to work infected can potentially spread the virus to their colleagues. It's critical to remember masking, physical distancing, and hand hygiene, and not let your guard down in areas such as break rooms or other common spaces where you may be closer to one another. All of us play a role in keeping each other safe and healthy, and your actions matter. We know our staff are dedicated and passionate about their work, and adhering to health and safety guidance and measures in place is not only important for your own health, it also protects those with whom you work and those who you care for. Thank you to all staff and physicians for continuing to follow COVID-19 preventive measures as we continue our pandemic journey and work to ensure the health and wellness of Albertans and one another. Thank you.
Together, we do amazing things every day.